Brain death generally means that the brain is not functioning anymore. It doesn't mean that the patient is dead, but most of the functions of the brain are actually not present. I'll give an example. The brain is supposed to move our hands, move our feet, and then usually it's also supposed to ensure that the eyes move exactly as you'd want them to move, you talk exactly as you're supposed to talk, and then all the other functions that you do when you're asleep. So we have two parts of the brain. There's the upper brain and then the lower brain. The upper brain basically is the awake brain, I would call it. It's the things we do voluntarily. I speak, I see, I do this, but these are things that we can sort of control. The lower brain would be that part of the brain that you can't control. So when I go to sleep, the part of the brain that will keep me breathing, my heart beating, is the lower brain, as we'd call it. So most of the times when the voluntary brain or the upper brain, what we'd call the cerebrum, gives off, like if it's switched off, then someone won't understand you. They go into what we'd call a coma. And then when the lower brain, which should keep you alive, stops functioning, then that's when we get to points when we say maybe a patient is brain dead. Of course, there are signs that would say that the patient is brain dead. One, we have pupils. There are those black spots in the eye. So these ones become big, and when you shine light into them, they will not be able to react, because when it's during, like when light is shown in the eye, the pupil will suddenly grow smaller. And then if a patient is brain dead, then when you shine light, they won't change size. They will just stay big and not react at all. And then the other thing we tend to check is if we put something in your eye, it's automatic. If someone tries to drop something into your eye, you'll blink. So in this particular state, if we try to put something in your eye, you will not be able to blink. And usually the eye will be a dry eye. And then the other things, so the brain has functions of controlling our breathing, and then our heartbeat, our blood pressure. So once we've gone through, the pupil is not reacting, the eye can't respond to, something put into it, then we sort of try to turn the head. When we turn your head, your eyes tend to go to the opposite direction. But in this case, when you turn this particular patient's head, the eyes will stay straight looking at you. They will not turn left, they will not turn right. So then, of course, now we start asking, because those are all points, those are all like nerves that come from the brain that do those particular functions. Then finally, we go down to the final part of the lower brain, which we call the medulla. And this one helps us breathe. So when someone is brain dead, sometimes when you take them off the machine, the breathing may stop, because now this is the final part of the brain. Or if we try, sometimes the tube that we help connect you to a machine, sometimes when you shake it, a patient is supposed to cough. And if they are not coughing, or if they are not gagging as would be, then we know that there's something wrong. So still as you're coming down, if we take you off the machine and you're not breathing for several minutes, then we start, knowing that probably you're brain dead. And then for some patients, we may go ahead to see the blood pressures. Usually, brain dead patients, the pressures are either low or not there. And so we may try to make sure that we keep everything to the norm. You may try to leave them on medication to just keep up the pressure. But if we see that your demand for the medicine to uphold your pressure is too much, then we start querying. Now, Clinically, we can't call a patient brain dead until we do a test. We want to do the brain electricity. So we'll put several wires on the head and then connect them to the machine. And that machine will help us see, are there waves coming from that brain? So if that machine shows us a straight line, it's like how we would see a heart that's pumping, and then suddenly it just goes into a straight line when it's quiet. So this particular machine will actually show us that, okay, the brain still has waves, let's give it its time, or it doesn't have waves. So we could do it clinically, but world over, we don't just do it clinically alone. We need other machines. And for us to say that someone is brain dead, you also have to make sure that they are not under the influence of alcohol, influence of drugs, their blood chemistry is normal, all the other things that would cause a patient to be unconscious should all be normal for you to say, okay, we think the patient is brain dead.